All right, so we can go ahead and get started. Welcome, everyone. Thanks for joining live on Facebook here on Mindful Nurses. My name is Janelle. I'm a co-founder of Mindful Nurses together with Claudia Wong, and we created Mindful Nurses to support nurses' mental health and well-being. We're both nurses ourselves who went through our own experience with burnout, and we've gone down this path of self-care and holistic wellness, and we really wanted to create a space for nurses to share this together. And so we are hosting these weekly Wellness Wednesday events featuring nurses talking about holistic health and wellness and self-care. And we have a lot of events for you every week, every Wednesday. This month we had plant-based eating to support your immunity. We have a naturopathic doctor speaking about mind-body medicine. I'll be sharing some breathing practices at the end of the month. And today we have a super exciting session here with Portia Wofford, who's here to share with us about writing, content writing. It's really important for our wellness to have freedom in our time, where we work, when we work, who we work with, to have that autonomy in our career. So we're really happy to have Portia here with us to share with us about this opportunity of content writing for nurses. She'll be sharing with us a little bit about content writing, how we can leverage our clinical knowledge and skills to create more autonomy in our career and lifestyle, have a schedule that works for you and your family, avoid abuse, short staffing, PTO, denied PTO, and burnout, how to potentially transition from your day job to be a successful freelancer. If that's something you're interested in, please join us today, right now. Portia is going to be sharing with us about how she took her passion for nursing and writing to create the life she wanted. Portia is an award-winning nurse, writer, content manager. After dedicating her nursing career to creating content and solutions for employers that affected patient outcomes, these days Portia empowers health-related businesses to grow their communities through engaging content that connects and converts. Portia is also the founder of No Nurse Alone, which is a community to build support for nurses' mental health, and a What's Your Number campaign, which gets nurses to acknowledge our mental well-being and shed the stigma around mental health. So we're super excited to have you here with us today. Welcome, Portia.
Thank you. Thank you for having me.
Thanks for coming. So anyone who's signing in live, please feel free to type any of your questions for Portia here into the box, and we'll try to get to those. And we'll just dive right in. So Portia, just tell us a little bit about yourself and what got you into writing.
Sure. So as Janelle said, I'm Portia Wofford. I'm a nurse. I've been a nurse since 2010. I started my career out doing long-term care and got a little burnout from long-term care after about a year. And a friend of mine actually worked at a home health agency, and they were looking for nurses, and she convinced me to sign on with the home health agency. And I did, and I really, really loved home health. And about a year into home health, I started realizing that my patients kept going back into the hospital, and I couldn't figure out why. What was the gap there? Why were they going back into the hospital? Was I not teaching them what they need to learn? And so I figured out that they really couldn't understand what I was teaching them. They couldn't understand like the patient brochures and education that the agency would give us. So I rewrote that material so that my patients could understand it, to try to keep them out of the hospital. So essentially my business started just by seeing a need that my patients had, and I always loved to write. So I figured, I started Googling, can I make money doing this? Can a nurse make money writing? Is this something that I can make a little extra money? I wasn't trying to make it into a full-fledged business, just a little extra money on the side, so that I wouldn't have to work a full-time job and a PRN job. And then I just kind of transitioned that, writing for one client, then getting another client, and transition that or evolving into a business.
Oh, that's wonderful. It's really cool how it started within the hospital, that you actually started writing there and then evolved beyond patient care in the hospital to find clients outside of the hospital setting to support that passion of yours. So maybe you can tell us a little bit about how you transitioned from having a full-time bedside job to going into working as a freelancer, and what have been the rewards and benefits you've seen in your own life of of making this transition to full-time hospital work to working as a freelancer, as a writer?
So I just started out with just pitching myself, pitching the services that I could do, pitching that I was a nurse, and that I knew how to write about healthcare things, health related things, and that I could write in a way that the everyday person can understand. As nurses, we do this every day. We teach our patients, about their disease process, about their signs and symptoms, about their medication. We break it down to where they can understand. And so I would just pitch to companies, this is what I can do for your readers who are most of the time the everyday person. And I just sign on clients like that. And then I also have some clients who their target audience are nurses. So they do a lot of content for nurses, what's going on in the nursing industry, things for nurses. And since I am a nurse, I have a lot of nurses that are friends. I know a lot of nurses. So I kind of know what's going on in our industry, and I can kind of write things that nurses like to write about. And I just kind of just kept writing, kept pitching myself, building my portfolio and sending that off to people. And to why eventually, I got enough clients to where I was able to let go of that PRN job in less than a year. I was able to let go of that PRN nursing job. And now my business is a full-fledged, it's a full-time business. I have multiple clients, I have, taxes and all these things that I have to do for the business. And it just started off with just pitching to one person, one client, and building up my writing skills to where I could pitch to other clients. And as far as it's helped me in my life because one, I don't have to work a full-time job and a PRN job and be stressed out. Because I think a lot of nurses, most nurses that I know work a full-time job and PRN job. And I felt like I want another job. I don't want something that I have to do as a nurse. I want to be stressed out. I don't want to have to deal with family members and doctors. I don't want to have to deal with writing nurses' notes and doing all these things. I don't want to be stressed out. So it has allowed me the freedom to where I let go of an entire job. And then I wanted to transition out of the bedside. I wanted to transition into another job. At the time, the job that I had, made very good money, but it was stressing me out. So I was able to take another job where I took a little bit of a pay cut, but because of my writing, I was able to kind of supplement that income. So now I'm not so stressed. I can spend time with my son. I can go to baseball games and football games and have my laptop with me and write. And I just, I'm just enjoying my life. I'm enjoying the freedom that it has allowed me to have.
Yeah, that's wonderful. And that's really inspiring that you were able to do this so quickly within a year to transition from full-time work in the hospital to having your own freelance writing business. You've done an amazing job. It's really inspiring.
Thank you.
Yeah. And I know you also have created a campaign or a business maybe called No Nurse Alone, and a campaign called What's Your Number? Could you tell us a little bit about that and what you're doing with that?
Yeah, so the No Nurse Alone campaign just came from me being stressed out as a nurse, knowing that there are a lot of other nurses who are going through the exact same thing. Maybe they don't have the support, or they feel like no one goes through what they're going through. They just need someone to talk to. I just created the campaign so that nurses know, hey, you're not the only nurse that's going through this. You're not the only nurse that's burned out. You're not the only nurse that might be struggling with your mental well-being. It's okay. There are resources for you. And then the What's Your Number campaign is part of No Nurse Alone. As nurses, we use the pain scale to ask our patients, what's your pain, 1 through 10? So I figured, why not take the pain scale and flip that and use it for us to be able to assess our own mental well-being. So 1 is, you're feeling really bad today, and 10 is it's the best that you've ever felt. So it's basically for nurses to assess our own mental well-being. And not only that, but for other nurses, if you see a coworker who's down, and you just ask that coworker, well, what's your number today? Just something for us to be able to assess what's going on with ourselves.
That's beautiful. And have you been implementing that where you work or online, or what have you seen as the outcomes or benefits of that so far since you've been doing that?
I have been implementing that with some of the nurses that I work with, and just kind of did like I guess you call it a quality assurance, a QA project to see. And they've been able to let me know how they're feeling. I was able to get some resources for nurses. So if you go to nonursealone.com, there are some resources on there for nurses to get, mental health or mental well-being help. Another nurse actually told me that she was working in the hospital and a patient that she had was a nurse, and he was going through some things, and she actually shared the campaign with his mom, and she was going to share it with him. And so it's all about just getting the resources for nurses. You know, it's all about me just finding resources out in the community, whether that's telecounseling visits, if, you know, that's telemental health visits for nurses, if that's just coming into a forum discussing what's going on at your job and you want to know if anyone else is going through that and how you can handle it. It's just more of a community support for us.
Mhm. That's amazing. And so if nurses wanted to access some of your resources for the No Nurse Alone, can you tell us where to access that or how to access that?
Yeah, the Instagram page is at No Nurse Alone, or you can go to nonursealone.com.
Okay, awesome. And okay, so back to your writing, because we really want to hear more about that, especially too for nurses who want to get started in the freelance content writing. Could you maybe just give us some tips, maybe tell us about your company and how nurses can get involved in the freelance writing?
Sure. If you're wanting to get into freelance writing, the first thing I suggest that nurses do is just figure out what it is that you might want to write about. You know, you might be an L&D nurse and you know a lot about L&D, and there are companies like there are parenting magazines. There are all types of different platforms who, if you go to say, hey, I'm a nurse, I work in labor and delivery, I would love to write an article for you about X, Y, and Z. First of all, you being a nurse, you're an expert in whatever your specialty is, and you know people trust you. So, and you can write in a way that their readers can understand. So just figure out what your niche is. Don't say you're going to write about everything in healthcare, because if you market to everyone, you're marketing to no one. So just figure out what it is that you really would love to write about, and then just start building your portfolio. It might be you have to do samples for your portfolio and send them out to people. That's fine. Just get 2 or 3 pieces that you can pitch to someone so they can see what you can do. They can see that you actually can write. And as far as the PW agency, which is my business, I actually have a team of nurses who I manage. So they write, I go out and I find clients and say, I have these nurses who can write about whatever it is that they want us to write about. And then the nurses, for me, they write their content. I help them edit it to make sure it's good. And then we send it to the client and they get paid for that.
Well, that's really wonderful. So your agency helps connects the nurses to the clients, so the nurses don't have to go out and find their own clients. You
Right.
really give them that support.
Yeah.
Yeah, that's great. That seems like it takes a lot of the stress away from starting out in this business to have that support of
Yeah, I
connecting
think
to the
it takes
client.
the stress away from the nurse, you know, the nerves away from the nurse. A nurse who may not have ever done this before. Whereas me, I'm kind of pretty used to pitching people and people telling me no or people telling me yes. And then not only that, it gives the nurse the opportunity to build his or her portfolio. So they might say, hey, they're not working for me. They're just contractors. So at any time they want to go and they want to find their own clients, that's fine. But it's kind of me just giving them that little boost to begin with. And then I have some nurses that have been able to go out and get their own clients, but just with me, they just have that little boost of confidence when you first start.
That's wonderful. And what about for nurses who have a lot of clinical skills and knowledge to leverage, but maybe they don't have so much experience with writing or a lot of skills in writing? Do you also offer support for nurses who need to learn more writing skills to get into this work?
Yes, I actually have a course or a mastermind that I have. It's called the Content Care Plan for Nurses. It teaches you how to start your own business. We have a membership called Nurses Who Write. So we have a free Facebook page called Nurses Who Write, where nurses can go in there and I drop all types of tips and things for them. And then we also have a membership with Nurses Who Write, where I kind of work a little bit more one-on-one with those nurses, and we just work together a little bit more. So I do have resources for nurses who feel like, okay, I want to do this, but I'm not sure if I'm a good writer, because I tell nurses all the time that you don't write like you were in nursing school. Like, you're not writing your thesis, you're not writing a dissertation, you're not writing a research paper. You're writing in a way that the everyday person can understand. And most people in the US read on like a 7th or 8th grade level. So you're having to write in a way that the everyday person can understand. It's a conversation that you're having with the reader.
Great. Yeah, that's so important to remember to keep our writing clear and simple and accessible for everyone. That's really
Right.
great. Great. And I'm just trying to see here if there's been any questions coming in from the audience. Yeah, feel free to type in any questions you have, or also we can give Portia's contact at the end if you have more questions you want to follow up with her directly as well, but feel free to type in any questions as we're here together live. Another question that I had for you, Portia, is just as someone starting out in the freelance writing, is there a range of prices that you can expect for writing articles, health content related articles?
Yeah, from you can get paid anywhere from $50 an article all the way up to, you know, in the $800, $900,000 per article. It just depends on what the market is, what the niche is, also your expertise and your knowledge, and also, of course, who the client is. So, you know, there's a range that you can get paid. I always say, you know, you're a nurse, you necessarily shouldn't be writing for free because you're an expert. You know, you're expert in whatever it is, whatever your specialty is. You went to school, you've been working in this industry, you've been working in this specialty. So you are an expert. And not only that, when you write as a nurse, these companies kind of get like a thumbs up from Google because they have an expert that's writing for them.
Mm-hmm. Awesome. And can you tell us a little bit about the clients that you work with?
Sure.
What range you work with?
So I have clients that have like 2 clients. So like nurses who have their own businesses, nursepreneurs, nurse entrepreneurs, whatever you want to call them. So small business owners. And then I work with large platforms, like large nursing platforms. I am working with some very large health care platforms, health media publishers. And we're actually transitioning this quarter into, we'll be doing a lot more with physicians, nurse practitioners, people like that.
Wonderful. So both small businesses and larger corporations in different areas. That's great. Okay. Any other? Great. And okay. So a question we love to ask to all of our guests is just what mindful nursing means to you. This is something that we've thought about a lot when we created this platform, for us to feel into what mindfulness is and what mindfulness is in the realm of nursing, and as nurses, what it means to be mindful nurses. So we'd love to hear from you what that means to you.
For me, being a mindful nurse is, one, you know, taking care of my patients in a way that it's not affecting me in a negative light. So it's not affecting my mental well-being. It's not affecting my sleep. It's not affecting, you know, when I'm home, I really can't, you know, spend time with my family the way I want to spend time with my family. So to me, it's just balancing, you know, what I do for my patients and then how I take care of myself, and knowing when I've reached that limit where I need to take some time for myself because I'm burnt out or I'm stressed and I know that it's okay for me to take care of myself, and I don't feel guilty for doing it.
Yeah, that's so important. Thank you so much for sharing that. It's really aligned with what we were feeling when we created this. Of just, as nurses, it's so easy for us to care for others before we care for ourselves, and it's so important as nurses that we're taking time to care for ourselves so that we have energy to care for others as well. So I think it's so inspiring, the work that you've done to create this transition for yourself, slightly away from the bedside, to have more space to follow this other passion that you have for writing, and to work when you want, where you want, with who you want, and have that autonomy and freedom. So it really reduce the stress in your life. So thank you so much for sharing with us a little bit about your story, and anything else you'd like to share about writing or your path, or anything else you want to share with the community today?
No, I just feel like if you want to be a writer, or even if you don't want to write, if you want have a side hustle or side business, just the first step is doing it. You know, we always ponder on the what ifs, and you know, we always say we surf the Google streets trying to find answers. So just go out and do it. You know, you're a nurse, you're so capable, we're so innovative, and we're so flexible. We do so many things every day that we don't even think about. But you know, I think almost every nurse has the capacity to have a business or a side hustle, because you're so multi-passionate, you're so flexible, you're able to multitask and do different things. So yeah, I just, you know, if it's something that you want to do, then go for it, and you know, don't feel guilty about doing something that makes you happy.
Mm-hmm. Yeah, I love what you shared about not feeling guilty about doing something that makes you happy. I'm wondering, because as you transition away from the bedside, you're still contributing to patient health, right, through writing. So
Yeah.
it's kind of like by doing what you want to do, you're still contributing to others. It's not a totally selfish endeavor, right?
Right.
Yeah. Yeah, that's wonderful. Well, we're super happy to have you share with us. And like I said, I'll be posting your contact here on the Mindful Nurses Facebook page. So anyone who wants to follow up with Portia at The Right Nurse, or is it The Right Nurse? Is that
Right.
right?
The Right Nurse.
Yeah, Right Nurse on Instagram, and her website as well for her writing agency. If you want to start writing and have the support of, like Portia mentioned, she has courses and masterminds and how to get started with writing, and a membership, as well as a paid membership, as well as free courses, and connection to clients if you wanted to start putting your writing out into the world and get started as a freelance writer. So we'll connect you with Portia, and also her No Nurse Alone campaign. If you need support through that, you can access that as well. So we'll have all of that contact information here. And also please stay tuned. We have these events happening every Wednesday with the Wellness Wednesday events. Next week, we have Vanessa Ruiz, who's a naturopathic doctor and nurse as well. And she'll be sharing mind-body medicine to build your resiliency in the time of the pandemic. And I'll be doing a session at the end of the month on breathwork practices to boost your mood. So please stay connected. You can join the Mindful Nurses community on Facebook as well. We have all of the recordings of these sessions, so totally free and available anytime you want to watch anything that's resonating with you. So thank you for tuning in, and thank you again, Portia, for sharing with us today. It was great to have you. Thanks. Have a good day.
Bye.
Bye, everyone.